therapist, osteopathically trained. I've been doing this for 30 years. And so I have a little bit different way for you to think about your health and how to take care of yourself. A lot of people come in with hip pain or back pain of a chronic nature, pains that just won't go away, headaches, neck pain, that sort of thing. And one of the key things that I find in all of these people is that they have an externally rotated hip, meaning that the hip is stuck to the outside, that when you try to rotate it in, it can't, and that'll usually be on one side. And oftentimes, especially if it's very chronic, you'll fix one side and then it goes to the other. So the test for that, for you at home, is to simply lay down on your back and try to roll your hips in. And you'll find that one may not rotate as well as the other one. And then, so that would be the side, that's the positive side, that's the side we'll treat. Now, for observation purposes, so that you guys can see what I'm doing, I'm gonna pick the right hip. And so one of the most important structures in this whole thing is your psoas major and the iliacus. The psoas actually pierces the diaphragm in its superior border, comes along next to the spine. So the psoas is actually in this groove beside the vertebral bodies, actually attaches to the discs on their lateral borders, their posterior lateral borders here, right where the nerves come out. So the psoas major is just in front of those nerves. So a lot of times people think they have a disc problem or this problem or that problem, and while they may, and that's what shows up in X-ray or MRI, what won't be observed is that the psoas itself is causing the problem. So again, back to these chronic problems, say that this person can't rotate on their left, the psoas tendon comes right through here on the hip, and you can see on a human, you wouldn't think that's the front of the hip, just because when you look at a skeleton, it's pretty obvious, but on a human, here's the pointy part of your hip, and there's where that hip joint is, and you can feel the femoral head rotate at that point, which means that's where the iliopsoas tendon goes across the anterior aspect of the hip. So what we want to do is, I like to use a more rigid ball. This is a 5-inch ball, the Orb. They're available on Amazon. So what you would want to do is lay on your stomach and get pressure onto that tendon and then rotate the hip. So in this case, we would do this. Now, if I were treating you, I would put my fingers there, right, and rotate to make sure that the freedom of rotation comes back. Sometimes that problem actually comes up into the iliacus, the belly of the iliacus, as we call that, and that's anywhere along this ridge of your pelvis, the interior ridge. So that would be in there. So again, if you can take that ball and get any pressure above the hip joint and into that area, and also the psoas coming along through here, you're not going to get all the way down to it, but you can kind of affect the tissue that lays on top of. And so I'd have you lay on the Orb, and again, not to have you roll around. I don't want rolling. A lot of people think, oh, you want me to roll around. I want you to go to a tender spot and hold. Also being cognizant that the aorta is somewhat closer to the middle. So if you get too close now, for me it's on your just off to the left side, you'll feel a very large ba-bump, ba-bump, and that would indicate you should not be on that. So move just to the side, have the ball move just to the side, and put your pressure there. So that pressure can be anywhere, so here's my bottom rib, from just under the ribs, okay, all the way down, maybe even a little more lateral, get a little more lateral pressure on it, and then down into the hip and pelvis. Now, sometimes you don't tolerate all that pressure. So I also have a gel-filled medicine ball. It's a rather small one. It's smaller than the 5 inches. So it's about 4.5, maybe 5 inches. And that one is much more tolerated by some people that are too tender in their abdomen. Now, because the aorta splits, it's okay to do that right in the center, just above the pubic symphysis. There are some organs and some other connective tissue there on the back of the abdominal wall. Sometimes the abdominal wall itself will either have scarring from surgery or pregnancy or injuries, and you may not even see that scarring. Secondly, from the belly button, or otherwise known as the umbilicus, you have your umbilical ligaments, actually your umbilical veins and arteries went down along the posterior surface of the anterior abdominal wall, and then they go down to your bladder, and then going superiorly, they go up down to the liver and pierce, attached to the vena cava, which is the main vein back that pierces your right diaphragm to go back to the heart. So those are two more sources of tension and pressure in there that will actually cause chronic low back, hip, or mid back or neck problems, just because they're not something that is treated typically by people. So that's the way we would approach that. You can use this same gel-filled ball in that way, but also get the center organs. If you can tolerate it, you can use the harder, the Orb on those places. And I just want you to go in, put pressure on, find a tender point, fairly painful spot, and then sit there. Now, if it's too painful or it goes bump, 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 get off that one and maybe consult your doctor if there's a real problem, or if any of the stuff that you do causes pain at night. That's always an indication to make sure that you're going to have whatever that is checked out. If you're my patient, come and see me and I'll take a look at it.